very slow on my side. Just give me a minute.
Live on YouTube?
We are live on the website.
Awesome. Good afternoon, everyone. I hope you're all doing well. My name is Frank Joseph. I am the Chief of Staff and Senior Advisor for Queensborough President Donovan Richards Jr. This afternoon, we're going to be talking about something very important, and I'm so glad that we're partnering with Jamaica Hospital on it, and that is fall prevention. So many of our elderly, our older adults, unfortunately, are impacted and face severe injuries when they fall. So to all the elected officials, health leaders, and community advocates who have joined us today for the Walk This Way Fall Prevention Workshop to talk about what is literally a matter of life and death, particularly life or death, particularly for our older adult population, we thank you all. And we have Jessica Dennehy, injury preventionist from Jamaica Hospital Medical Center here. And we thank you and Jamaica Hospital for co-hosting today's important event. You know, from us just looking at the numbers, we see that in the borough of Queens, there's an average of 1,352 fall-related hospitalizations for every 100,000 adults who are 65 and older. And this happens every year. The citywide average of fall-related hospitalizations is actually a little over 1,600 persons per 100,000 adults. And the Queens neighborhoods right here that we see that have the highest rates of falls are Kew Gardens, Woodhaven, South Ozone Park, Howard Beach, and Rockaways and Broad Channel. And Jamaica, Hollis, Queens Village have the 3 lowest rates of falls in the entire borough. Now, in terms of cost, fall-related injuries are the leading cause of unintentional injury death for individuals who are 45 or older, and fall-related injuries are associated with a yearly cost of $1.3 billion right here in New York State for hospitalizations alone. And it costs a little under $1 billion in New York City. Falls are the leading cause of injury for older adults, and we define that by individuals who are 65 years and above here in New York City. And emergency department visits that are related to falls have increased in recent years. We see that there was a 22% increase in fall-related emergency department visits from 2006 to 2010. And then from 2010 to 2020, the older adult population is anticipated to, or has been, was increased by 45%. And we know that this can further increase the health and economic burden of fall-related injuries, unfortunately. So there is a high cost to this, not just in terms of capital dollars, but in terms of lives. And so for these reasons and many more, especially during this COVID-19 pandemic, which we are still in, it is important to get this information out to the community to educate themselves and take the appropriate precautions. Briefly, I want to say that it is vital to mention that Queens residents have been resilient in the face of the pandemic. We know that a little over a year ago, it feels like we're creeping on 2 years in a few months, the borough was the hardest hit from this awful virus. We call it the epicenter of the epicenter. And Queens, though, we bounced back. We became the first borough to have 1 million residents vaccinated. And I want to thank our healthcare heroes and frontline essential workers who selflessly served here in the great borough of Queens during our time of need. And we are internally in your debt, and we need to do more for our healthcare heroes and our essential workers. And to all those who have lost a loved one during this pandemic, I want you to know that we are thinking of you. Now to the 1.7 million Queens residents of all eligible ages who have received at least 1 shot of the COVID-19 vaccine, I want to say thank you for doing your part in keeping our communities safe. I saw the whole NBA Hall of Famer Charles Barkley said just yesterday that taking the vaccine is not about you, it's about protecting those around you. And you, 1.7 million Queens residents, get that. So please trust the science and get your shot today. The Delta variant is spreading. New variants are always, evolving and emerging. We don't have a second to waste. We're going to continually work with our partners in government and in healthcare to strategize the best ways to engage the communities that are most impacted and least represented when it comes to vaccination shots. And we're going to try to break through any historical distrust of medicine in our minority communities. The fact is, we have to work together towards higher vaccination percentages as we continue to gather with our friends and family this fall. Thanksgiving is coming, Kwanzaa is coming, Hanukkah is coming, Christmas, the New Year, so many various holidays. And we know we want to come together with family and friends and loved ones. And so in order to do that safely and to not have our individuals at risk, we have to get vaccinated. And so it's important that though we're talking about fall prevention, a matter of health, a matter of life or death, that we also talk about the pandemic, also a matter of health and life or death. So we look forward to doing all that we can do to make sure that our great Queens comes back, continues, uninterrupted by this virus, uninterrupted by any unnecessary deaths. And so we are so happy that you're here today to learn more on how to prevent falls, on how to protect those who are most vulnerable, our young kids who are learning to walk, our older adults who are oftentimes the most impacted by fall-related injuries and deaths. So with that being said, I'm proud to stand here with all of our friends, understanding that healthcare and well-being is important and it is a priority for us here in Queens. And we're happy to talk to you today during this webinar session. So thank you, and I look forward to continuing our work together. Without further ado, from Jamaica Hospital, I'd like to present Jessica.
Thank you so much for that great welcome, Mr. Joseph. I'm so happy to be here. I'm going to be presenting my Watch Your Step presentation on fall prevention. As mentioned, falls are a huge burden, and however, on the great side, falls can be prevented. This is a photo of Balanced Rock in Utah. This rock stands at 128 feet tall. However, it is not actually balanced. It sits between two different rocks, demonstrating that balance is a multi-system that requires the use of sometimes assistive devices. Postural control. Balance is learned, balance is taught, and balance is multi-system, as mentioned and as exemplified from Balanced Rock that sits between two other rocks. Balance is a function of muscles, bones, nerves, ligaments, vision, hearing, brain, and memory. There are three main systems that are needed for balance: vision, vestibular, meaning your ear, and sensory, kinesthetic awareness. Vision requires individuals to keep up with their yearly eye checks to make sure that they can see properly to prevent falling and keep their balance up to date, as well as your ears. Your hearing greatly impacts your depth perception and plays a large role in not only preventing falls, but keeping your balance up to date, as well as sensory, sensing what is around you. And we'll get into this, but why wearing proper footwear is important. Many people come in and they say, I used to have such great balance. However, balance is a skill. When was the last time you actually worked on your balance? Balance is one of the first things that is lost when you stop practicing. However, it is one of the quickest things that return when you start practicing. Balance is a combination of muscles firing at the right time and doing the right thing to keep you upright. Many people come in and they ask, why did they fall? So there are internal reasons for falls, including medical pathology, such as if you have an underlying condition, some of which can contribute to increased falls, such as multiple sclerosis or arthritis, impaired sensation, decreased strength, which your strength decreases with age, tightness in your joints, vision impairments, dizziness, as well as certain medications. External reasons for falls include perturbations, flooring issues, obstacles, light, conflicting environmental stimuli, such as sounds, colors, and surface level issues. Why it is important to be aware of your surroundings. On the good side, as I mentioned, falls can be prevented. Check your medications. One thing to do is to make sure that you get all of your medications from the same pharmacy, so that way they can be reviewed by the pharmacist, because the medication that your cardiologist gives you might interfere with medication that your primary care physician gives you, which is why at every doctor's appointment, it is important to bring with you a list of all of the medications that you take, so that way they can be reviewed by each doctor. Additionally, falls can be prevented by looking at external factors. Loose rugs that come up after walking or opening a door on them. This can be fixed by getting rid of rugs or using double-sided tape. Pets or children that are on the floor. Many people have pets that sit at the bottom of their feet, and when they stand up, they trip over their pet. High shelves. If you're regularly standing on a stool to get to the top of the shelf, you might want to move your most commonly used items to a lower shelf that is accessible. Unsteady rails or steps, even missing steps, can contribute to falls. And why it is important to make sure that you have handrails on your steps. Wet or smooth surfaces as well. Lighting, if you don't have adequate lighting, one thing to make sure is having lighting accessible to you in your bedroom next to your bed, and make sure that you have a light source between your bed and the restroom in the middle of the night. And sound and other stimuli, which can be distracting and can lead to a fall. Moving on, there's also footwear. Make sure that you're wearing appropriate footwear and that there's no clutter on the floor. If you have small children or animals that you live with, you want to make sure that they're not leaving items on the ground. And getting out of bed. So moving from that horizontal position into a vertical position can change your blood pressure, leading to a blood pressure drop, making you dizzy. Why it is important to get out of bed slowly. Internal factors that can be done to prevent falls are exercise, strengthening exercises and stretching your joints and muscles, keeping your blood pressure in check, those eye and hearing checks. Osteoporosis can contribute to increased falls. However, I want to emphasize that if you ever do fall, that you should speak with a doctor or nurse and keep track of your falls. There might be patterns. Maybe you're always falling at a certain time of day, or falling after taking a certain medication, or falling in a certain location, and you can identify your risk factors. This is important because falls can lead to serious injuries. 40% of individuals who fall and have a hip fracture do not return home. 95% of hip fractures are actually caused by falls. Falls can lead to ankle sprains and head injury, shock, organ damage, rib fractures, and in some cases, a fall can even lead to death. Over 33% of all people over 65 years of age will fall, and falls are the leading cause of death among the elderly. 55% of falls occur inside the home, 30% occur in the living room. 25% of seniors who are 65 and up who fall are hospitalized. But again, I want to emphasize that falls are preventable. As mentioned, the cost of falls is incredibly high. Just in the USA alone, $50 billion is spent annually on medical care related to falls. Falls can also lead to lost earnings. If you fall and you can't go into work due to injury, lost time with family, missing out on social events, travel plans, and family gatherings, which are invaluable. In terms of personal health for fall prevention, if you take more than 3 to 4 medications, check in with a doctor and/or pharmacist. Make sure that you're getting your vision checked at least every year, sometimes more often as directed by your doctor. Any changes in hearing, check those out. As mentioned, hearing changes can lead to impacting your depth perception. And exercise daily to prevent disuse and tightness in your joints. Exercise daily does not mean that you need to do intense exercise. I know when I hear the words exercise, I think about going to the gym, jogging, and intense exercise, which is great if that works for you. But there are other ways to exercise. You can exercise with what you have. You can just take a walk daily, and you can find a buddy to make walking enjoyable and to help you stay on track with your goals. You can walk outside. You can even walk around if you live in an apartment complex and you don't want to leave. Make walking enjoyable. You can turn it into a game. The goals of exercise in relation to fall prevention are to build balance, promote strength, and encourage activity. Your balance and strength will decrease as we age. Our muscle mass decreases with age, which is why it is so important to work on. As I said, exercise does not need to be intense. You can exercise for even just 5 minutes a day and build from there. You can do balance activities at home. Some people say that they'll do balance activities while their food cooks. They'll stand on one leg while they're waiting for the water to boil. They'll get up during TV commercials and just take a walk up and down the stairs every time a commercial comes on. In your kitchen, you can lift weights by using a milk jug or a water jug or a soup can, whatever works for you. Before starting a new exercise routine, here are 3 important questions that you should ask your doctor. Are there any exercises that I should avoid? Some exercises are not good if you've had certain surgeries or if you've fallen, so it's important to talk to your doctor. Make sure, number 2, that your preventative care is up to date. And number 3, how does my health condition affect my ability to exercise? Talk to your doctor if you experience any of the following: dizziness or shortness of breath, chest pain, blood clots, fever with muscle aches, unplanned weight loss, sores that won't heal, or joint swelling. And I really want to emphasize that you should take care of your body and do not overexert yourself. You might look up an exercise tutorial and it might recommend doing 3 sets with 10 repetitions, and that might not work for you. That might be too difficult for certain exercises. So I really want to emphasize to do what is best for your body. Don't push yourself and don't put yourself into any pain. I'm going to go over 3 examples of great exercises. These are toe lifts. One thing to note, you see this individual is holding onto a chair. Make sure that it is not a chair with wheels that will roll around. And you want to lift yourself up using your toes up and down. That is great for stability and building your calf muscles. Here are 2 leg exercises. Again, don't use a rolly chair. And for the exercise on the left, you take turns kicking your leg out. Make sure that you're holding onto something firm and steady. These are great exercises that you can do anywhere in the house. You can do these in the kitchen while you wait for food to cook. And those are just some little ways that you can incorporate exercise into your daily routine. The exercise on the right involves sitting upright and picking up one leg at a time and drawing it up. This individual in the photo has their leg drawn up that's parallel to the floor. Not everybody will be able to do that. Lift your leg up as much as possible and make sure that you do not hurt yourself. The final exercise is a chairlift. This is recommended by the CDC. Study stopping elderly adult deaths and injuries. This involves sitting down and then standing back up. That is great for your glutes and your hamstrings and building overall strength and balance in those areas that will help prevent falls. As I said, walking is a great way to build your balance and to promote strength. I just want to mention that if you do choose to exercise outside, make sure that you stay mindful of outside hazards. You might come across broken street or sticks and debris on the ground. Now with the cooling weather, watch out for ice, or if it just rained, it might be slippery outside and you might want to wait to walk for another time. And watch out for cars and cyclists as always. If you do go out on a walk, make sure that you bring your ID with you, such as a license or a photo ID. Bring an emergency contact information in case you need to call for help, and bring your cell phone with you when you go out, so that way you can be contacted. And again, be mindful of the sunset times. Sometimes when I want to go on a walk in the evening, I check my weather app to see what time the sun will set, so I can make sure that I'm mindful about being home before it gets dark out. When it's dark out, that creates a lot of hazards. You won't be able to see if there's cracks on the ground. And more importantly, you might not be as visible to other pedestrians, to other car drivers or cyclists. So make sure that you avoid walking in the dark. And when you are walking or exercising, make sure that you're wearing proper footwear. This photo is taken from the National Council on Aging, and it is their recommended footwear. It involves supported heel collar, low heel height, an angled heel, soles that prevent slipping, and its shoelaces are Velcro, so that way you can get shoes snugly on your feet, and a thin, hard sole. Make sure that there's enough room for your toes and a cushioned arch on the bottom of the shoe that is not too high and not too thick. Footwear to avoid are loose worn backless slippers, slip-on shoes such as slingbacks or flip-flops, which can slip and trip, shoes with slippery or worn soles that can cause you to slip, especially in wet weather. Make sure that you avoid shoes with a heel higher than 1 inch, narrow heels, because those can make walking unsteady and can make your ankle turn and easily lead to an ankle sprain or a fall. Especially avoid walking in narrow heels when you're outside. If you step on a rock or an uneven surface, that can really increase the chances of having a fall and injury. And again, proper footwear should be worn both inside and outside of your home. The image on the right has shoes with a rubber sole to prevent slipping. Wearing socks inside on hardwood floor can cause slips and trips. You want firm, slip-resistant soles for both inside and outside the home. Keep in mind, high heels, higher risk of falling. Again, on the good side, falls are preventable. Regular exercise can reduce the rate of falls by 23% and the number of people who fall by 15%. A healthy diet and maintaining blood pressure can help reduce the risk, as well as staying mentally active. Cognition is a key aspect in fall prevention. Overall, keep up with health, regular primary care visits for medication checks, vision checks, and hearing checks. All three are vital in preventing falls. A fall can happen anywhere. As we mentioned, 50% of falls happen at home. So make sure that your home is safe and fall proof. They can happen on the street. A lot of falls happen outside when entering a car, bus, or taxi, and public places. Staying mentally active can be done through mind-body connection exercises such as Tai Chi and yoga, as well as social interaction. We can socially interact with others at a distance. We can go for walks with others. We can FaceTime. We can use Zoom or another web-based platform. We can write letters to our friends to increase our social engagement. You can also play games that challenge your mind, such as crossword puzzles and electronic games in your computer. My favorite personally is Tetris, that you can use to increase that mind-body connection and stay mentally active. That helps fall prevention. And if you're being active, make sure that you're drinking water throughout the day. It is recommended to drink at least 7 cups of water. Bear in mind that if you're drinking water close to bedtime, you might need nighttime urination, which is getting up in the middle of the night. When you get up, watch out for that blood pressure drop, which could make you dizzy. And as I mentioned, this is why it is so important to have a light next to your bed in case you need to get up. You never want to be walking in the dark. So make sure that you have a light to guide you between your bedroom and the restroom. Also, to prevent falls, going more in detail on blood pressure now, blood pressure abnormalities can contribute to fall risk. Low blood pressure is hypotension, and high blood pressure is hypertension. Low blood pressure can be caused by this non-exhaustive list of medicines, such as water pills, also called diuretics, and alpha blockers. It can also be caused by dehydration, which is why it is so important to make sure we're getting at least 7 cups of water a day. You can also lack certain nutrients in your diet, such as B12, folate, or iron. Again, that is a non-exhaustive list. And low body temperature can lead to low blood pressure. Low blood pressure usually drops after standing. So when getting up from sitting on the couch, and especially from lying down, make sure that you're standing up slowly and counting down from 5 to make sure that you avoid that lightheadedness. For high blood pressure, that can develop gradually from aging, from not being physically active, why exercise is so important, from being overweight. It can develop from genetics, family history, using tobacco, too much salt, sodium in your diet, being low in potassium, and stress can cause high blood pressure. Exercise also helps to alleviate stress. And we can control our blood pressure through diet, through eating a healthy diet full of fruits, vegetables, whole grains, low-fat dairy products, and you'll see I included a photo of a banana because bananas are a great source of potassium. For more detailed nutritionary advice, I would advise everyone to speak with their primary care physician to get more detailed advice that works best for you. And you can also utilize lifestyle changes to control your blood pressure, keeping a healthy weight, exercising, eating low salt, drinking less alcohol, not smoking. No matter what your age is, you are never too old to quit smoking cigarettes or tobacco. Make sure that you're getting a good night rest and manage your stress levels. Again, keep your medication up to date. Taking your medication on time is important. 28% of hospitalizations for older adults are drug-related. Pill boxes and lining up medication in a prominent area can improve your medication adherence. Let's say every day you like to start your morning with a cup of coffee or a cup of tea. You can keep your medication near your coffee and tea to make sure that when you're starting your morning routine, your medication is incorporated into the morning routine. You can keep your medication out in a place where you will remember to take it. You can set yourself a reminder by writing a sticky note on your fridge or setting a reminder on your phone. And when you're speaking with your doctor or pharmacist and you're getting your medication, ask for the instructions in writing. We've all been there when we're at our doctor's appointment, we're given a new medication, we're told how to take it, and then going home, we run into problems, we run into traffic, and everything happens and we forget what we're told. Never be afraid to ask your doctor to write down all of the medications, when you should take them, and in what quantities. If you're ever unsure, call your doctor or pharmacist to ask. Overall, if you have fallen, get help. Establish a system to get help, such as a neighbor, a relative, EMS. Someone I know who falls has a knocking system set up with their neighbor. So when she falls, she has a knock pattern. So that way her neighbor can identify that she fell and go help her. Make sure that you have a way to call for help. Call 911 if necessary. Report the fall to your doctor or nurse. They can help identify risk factors and correct the environmental hazard as soon as possible. If you've fallen in your house, and let's say you tripped over a rug, you might want to remove that rug or get double-sided tape for that rug, so that way you can avoid falling from that same reason again. You can have a relative walk with you through your home to identify potential fall hazards and ways that you can fix them. If you have fallen, the physical medicine and rehabilitation department we offer here at Jamaica Hospital has physical therapy, occupational therapy, speech therapy, as well as audiology services for your hearing. If you have questions, I'll leave this slide up for a moment. You can reach Jamaica Hospital at 718-206-7140. And this is in the Department of Physical Medicine and Rehabilitation. We can answer questions as well as provide referrals. Additional resources for fall prevention: ACL, Administration for Community Living, NCOA, National Council on Aging. They have a Center for Healthy Aging, and they have their National Falls Prevention Resource Center, as well as the CDC, Center for Disease Control, STEADY, which I mentioned earlier, stopping elderly accidents, deaths, and injuries. Overall, thank you so much for listening to this presentation, and I hope that you have a great day.
Jessica, thank you so much for that wonderful presentation on fall prevention for our seniors. On behalf of Queensborough President Donovan Richards, I would like to thank you and everyone who took time out to watch this workshop. And please be safe. Thank you and have a great day.
Thank you so much for the space. Have a great day.